Hi, my name is Kiera. I'm the lactation consultant here at Lane, and I'm going to show you how to set up your Ameda Pearl. So this is for my moms who choose to pump, or if you're separated from baby, like babies in special care nursery or babies in the NICU. You need to be pumping pretty frequently, at least 8 times a day, which is roughly about every 3 hours. So the pump will mimic what baby would do at the breast. So when you first open up your kit, everything comes already put together. So what you'll do is you'll just take this tubing right here and you will plug it right in here. So typically I have my moms pump both sides at the same time, but if you choose to do one at a time, you'll just take off one of the tubings, plug it in, and you can close the other side. And you'll just plug it back in just like that. But typically we're pumping both at the same time for 15 minutes. If you do one at a time, then you're doing each side for 15 minutes. All right, so it plugs in right there. You want to make sure it's plugged in pretty well. Just put this on. All right, so it comes with one flange, which is the 25. You want to make sure that you have a nice seal and that the nipple is centered. You don't want to make sure that it's not off center, so your nipple isn't rubbing up against the flange. So once you have it nice and centered, you can turn the pump on right here. And so it starts off in what's called stimulation mode, and it tells you right there. And then it also has a timer so you can see. So whenever it's on stimulation mode, I don't know if you can see, but it's barely moving the nipple. So what it's doing, like I said, it mimics what baby would do at the breast. So at the beginning, baby isn't getting a lot of milk, so baby is sucking really quickly to bring the milk down. So that's what this pump is doing. And you can adjust the suction in stimulation mode, so it pulls it a little bit harder, but it's also pulling it fast. It should not be painful, so if it's hurting, turn that suction back down. It goes all the way up to 6, but most people don't have it turned up that high. So at 2 minutes, this pump automatically switches over to expression mode. So I'll press this button right here to go into expression mode. But like I said, the pump does it on its own, so you don't have to. So expression mode, it slows down and it pulls it a little bit harder. So we have the speed at 1, the suction at 1. So you can adjust the speed. So that's adjusting how fast it's pulling. And then the suction controls how hard it's pulling. And so you can see it's pulling a little bit harder. And then, like I said, we can speed up, increase the speed as well. So if it starts to hurt, first thing you want to do is move that suction back down. If both need to be at 1 for you to be comfortable, then pump at 1. So what we're doing is getting the stimulation that your body needs to make milk. So the first 3 days at least, you have what's called colostrum. That's your early milk, which is really thick. The pump doesn't do the greatest job of removing that thick colostrum, but like I said, what it's doing is creating the stimulation that your body needs to make milk. So we're pumping on this for at least 15 minutes. And I'm gonna stop it. Whenever you're finished, you take the flange off. The first couple days when you're pumping, you may only get drops. And that is completely normal. I'm not expecting milk to just be pouring out at this point. Now, if it is, great. But if it's not, it's okay. Like I said, we're just stimulating. So whenever you're finished pumping, I want you to wash your parts. So if you only get like some drops on the flange, then you don't need to wash everything. You'll just take this off. So you don't have to wash the tubing or this cap because it doesn't come in contact with the milk. So you can kind of just put that off to the side. You'll take this out. And sometimes milk gets on here. Usually it doesn't though, so you don't have to wash that if it doesn't come in contact with the milk. And then you'll take the bottle off. So let's just say you have milk in there. You'll set that aside. And you want to make sure that you're washing with warm soapy water, making sure that the soapy water is going all the way through it. You can even take off this little duckbill valve, which is kind of hard. You kind of just pull it and it comes off. Wash it, rinse it really well, and then you can set it aside and let it air dry, so that for the next time you pump, it's already ready to go and all you have to do is put it back together. So it just pops off and on like that. When you're ready to pump again, put that back in, you put your bottle back on, and then you just pop the stop back on. I'm gonna also show you what comes with it is a hand pump as well. So some moms prefer the manual pump over the electric, and you can kind of play with them and kind of see which one you prefer. So it's a weird little hand pump, but it goes right around the bottom part. Put that on, or let me put this part on first. So you put that in there, and then that kind of just pops on just like that. And then same thing, make sure your nipple is centered, and all you're doing is squeezing. And so if you're using this, sometimes the manual pump gets the milk out more efficiently than the electric pump. But I always recommend hand expressing after each pump. Because like I said, the pumps don't do a great job of removing the thick milk. Hand expression helps get that milk out. And so what we can do, make a C with your hands, your fingers, on the outside of your areola, push back into your chest, compress, and kind of hold, and then relax. Push back into your chest, compress, and hold. You don't want to like stretch your fingers. You want to keep them in place. Push back, compress, and hold. Even if you're not getting anything, your breasts are still getting that stimulation to tell your body to make milk. But if you ever need any help with your pump, setup, or anything, you can always ask your nurses. Thank you.